Hello everyone, welcome to the channel GDC English. In this video, we're gonna have NSAIDs, that is non-steroidal anti-inflammatory drugs. In this video, we're gonna have classification, mechanism of action, as well as the pharmacological actions of NSAIDs. That is going to be a very much important topic for you guys for your GPAT, NIPER, or any pharmacist exam. So let's get started. So first of all, we need to understand what is NSAIDs. So what is NSAIDs? The full form of NSAIDs is non-steroidal anti-inflammatory drugs, which are of non-steroidal nature, which are basically used as for the analgesic activity. We do have two types of analgesic drugs. First one, that is non-steroidal. Second one is steroidal, which may be opioids. These are the peripheral acting. Non-steroidal anti-inflammatory drugs are peripheral acting, whereas opioids are the centrally acting drugs. All right. So we do have a lot of autocoids inside our body. Autocoids. Autocoid means the local hormones. For example, they get synthesized and show function on the same side. It means wherever it gets synthesized, it do function on the same side. All right. So there are local hormones. For example, the prostaglandins, histamine, and serotonin. And we do have a lot of kind of local hormones that is called as the autocoids, that are local hormones which are act on the local side. All right. So they are not going to move onto the other side, just like the hormones, endocrine hormones or exocrine hormones. These local hormones are synthesized at one place and function all to the same side. All right. So let's move on to the first mechanism of action for you guys. That would be beneficial for you. That is NSAIDs mechanism of action. So what generally happens? We do have cell membrane phospholipids. Cell membrane phospholipids, because we do have cell and it do have cell membrane also, isn't it? So these cell membrane phospholipids have the phospholipase A2 enzyme. Phospholipase A2 enzyme, which generally present or activates or stimulate when there is a physical, chemical, or inflammatory or mitogenic stimuli gets there. All right, due to any physical condition, physical trauma, or you can say that you got some injury over here, you got your some chemical harmful chemicals over here. That means tissue response. That is a tissue response. Phospholipase A, that is generation of phospholipase A, is a tissue response which produces the arachidonic acid, and this arachidonic acid generates COX enzyme as well as the LOX enzyme. COX enzyme as well as the LOX enzyme. COX enzyme are of two types, COX1 and COX2. COX1 and COX2. Simultaneously, it also generates the LOX enzyme, which are responsible for the generation of leukotrienes. All right. Here, the arachidonic acid, which are responsible for generation of COX1 and COX2, as well as the LOX enzyme, COX1 and COX2 are responsible for the generation of prostaglandins. Prostaglandins are also the local hormones. Leukotrienes are also the local hormones, whereas the COX and LOX are specifically designed for other things. All right, COX is for prostaglandins, LOX is for leukotrienes. Alright, chalo. So COX-1 and COX-2 enzyme generally produces the prostaglandin H2, which also generates a prostaglandin H2, G2 and as well as the G2. And prostaglandin H2 converts into different types of the prostaglandins just because of the isomerases. They are structurally kind of similar thing, but they do have a different kind of actions on different parts of the body. All right. For example, prostacyclin, that is PGI2, thromboxane A2, prostaglandin D2, prostaglandin E2, and prostaglandin F2 alpha. These are also known as the prostanoids. All right. And these are the prostaglandins which are present on the different parts of the body as well. We will cover that into the prostaglandins part. All right. So, what does this NSAIDs do? That is NSAIDs, that is non-steroidal anti-inflammatory drugs. It blocks the COX-1 and COX-2 enzyme. COX-1 and COX-2 enzyme. This is an enzyme present over here, which are responsible for the conversion of arachidonic acid into the prostaglandins. All right. So NSAIDs is going to block this one, COX-1 and COX-2. Ultimately, reduces the synthesis of PGs, isn't it? It will decrease down the synthesis of prostaglandins. Yes. So all the functions of prostaglandins will be inhibited. All right. So this is the kind of mechanism of action of non-steroidal anti-inflammatory drugs. All right. So let's move on to the classification part, which is a very important for you, and you can expect a one question from here directly. So sure. Very important. Very important. One question at least you will find from here only. That is my guarantee. All right. So we do have different kinds of classifications, not different kinds of classification, but categories as well. So A, that is non-selective COX inhibitor. That means it will act on COX-1 as well as COX-2. Okay, this will inhibit COX-1 as well as the COX-2 inhibitors. So this can be learned through SAFE PP. SAFE PP. S for salicylates, A for acetic acid derivatives, F for phenamate, E for enolic acid, A for P for pyrrolozone, and P for propionic acid derivatives. All right. S for salicylates, A for acetic acid derivatives, F for phenamates, E for enolic acid derivatives, and P for propionic acid derivatives, and P for pyrazolone derivatives. All right. Salicylates, you will found the aspirin and diflunisal. That is aspirin as well as the diflunisal. Aspirin is the prototype drug. It is the prototype drug of NSAIDs. All right. Note one thing, that aspirin binds irreversibly. Aspirin binds irreversibly to COX enzyme. Irreversibly bind to COX enzyme. All right. Propionic acid derivatives, pro. That is pro. You can learn through the pro. For example, ibuprofen, naproxen, ketoprofen, flumbriprofen. All right. So you will see a pro word in each of the drug. Ibuprofen, naproxen, ketoprofen, flumbriprofen. All right. Phenamate, mefenamic acid, which is generally used for the spasmodic activity, antispasmodic activity. All right. Generally, in the time of the menstrual cycle, women do take this mefenamic acid as a antispasmodic drug. All right. E. Enolic acid derivative. Enolic acid derivative, that is pyroxicam and tenoxicam. All the drugs which are having the cam word as a suffix will be considered into the enolic acid derivative. All right. Except meloxicam. Meloxicam is not an enolic acid derivative. It is a preferential COX-2 inhibitor. All right. Acetic acid derivative. Acetic acid. Ketorolac, endomethacin, nabumeton. Ketorolac, endomethacin, nabumeton. All right. Acetic acid derivative ketorolac. AC. Ketorolac. Endomethacin. AC. Over here. Nabumeton. These are the drugs which are considered to be the acetic acid derivatives. All right. Pyrazolone inhibitors. Pyrazolone derivatives, that is phenylbutazone and oxyphenbutazone. Phenylbutazone and oxyphenbutazone. All right. Preferential COX-2 inhibitor. Preferential COX-2 inhibitor can be learned through and me. And me. That is A for aceclofenac, N for nimesulide, D for diclofenac, M for meloxicam, and E for etodolac. All right. This one, the etodolac, should not be confused with acetic acid derivative. No, it shouldn't be there. It is into the preferential COX-2 inhibitor, meloxicam and etodolac. Meloxicam and meloxicam is the enolic acid derivative, whereas etodolac is an preferential COX-2 inhibitor. All right. Selective COX-2 inhibitor, you will see the coxib word. Coxib. So, celecoxib, etoricoxib, paracoxib, refacoxib, all the words having suffix coxib will be considered as selective COX-2 inhibitors. All right. Next category is analgesic antipyretic with poor anti-inflammatory action. Analgesic antipyretic with poor anti-inflammatory action. So these drugs having the poor anti-inflammatory actions. All right. First, we do have para-aminophenol derivative, that is the paracetamol acetaminophen. Pyrazolone derivative, metimazole and propifenazone. Benzoxazosine derivative, that is nifopam. All right. So this is all about the classification. I hope I have made you clear around this classification topic through trick, and you can learn it easily. All right. So now let's move on to the pharmacological effects. Pharmacological effects. All right. So pharmacological effects. The first one is the analgesic effect. This is very common because it is a non-steroidal anti-inflammatory drug. So it do have the analgesic effect. How? What is the mechanism behind it? Because the NSAIDs block prostaglandins synthesis by inhibiting the COX-2 enzyme. Mainly which enzyme? Mainly COX-2 enzyme. All right. Prostaglandin sensitizes pain receptors to inflammatory mediators like bradykinin, TNF alpha, and interleukins. What generally happens whenever we do have a pain? So, how this pain generates? Prostaglandins do what? Prostaglandins sensitizes, stimulates these pain receptors over here to inflammatory mediators. We do have a lots of inflammatory mediators inside the body. That is, for example, bradykinin, TNF alpha, as well as the interleukins. All right. So these are the inflammatory mediators which are being sensitized towards the pain receptor. All right. And who sensitizes this pain receptor? This one, the prostaglandins. Whereas the NSAIDs is blocking the synthesis of prostaglandin by inhibiting the enzyme COX enzyme, mainly COX-2. By inhibiting PG synthesis, NSAID reduce the sensitization, hence less pain perception. All right. Peripheral analgesia, unlike opioids, which are centrally, NSAIDs inhibits the peripheral analgesia. All right. Unlike opioids, which are centrally active. All right. So next one, antipyretic effect. Antipyretic effect. Mechanism is occurs. How generally fever occurs? Let's talk about that. Fever occurs due to pyrogens. What are the pyrogens? Pyrogens are the interleukin 1, interleukin 6, and TNF alpha, stimulating PG synthesis in the hypothalamus. We do have hypothalamus in our mind, in our brain, isn't it? We do have that. And what it generally happens whenever fever occurs due to pyrogens, interleukin 1, interleukin 6, and TNF alpha stimulate PG synthesis. PG synthesis in the hypothalamus. That's why hypothalamus regulates the body temperature, isn't it? So that's why hypothalamus increases the body temperature set point. NSAIDs do what? NSAIDs inhibit PG synthesis in the hypothalamus, reset the temperature to normal via heat loss, that is through sweating or vasodilation. Alright, and there will be a no effect on normal body temperature. Whenever there is a person who is having a normal body temperature and he takes NSAIDs, it generally have a no effect on the body temperature. That is a normal body temperature. All right. So next part, that is anti-inflammatory effect. Anti-inflammatory. What is the mechanism behind it? At the site of injury, prostaglandin contribute to inflammation, that is pain, redness, and swelling. NSAIDs do what? NSAIDs inhibit COX enzyme, decreases PG synthesis, as well as reduce the inflammation. Example, ibuprofen, diclofenac, naproxen, and all the non-steroidal anti-inflammatory drugs. All right. Antiplatelet aggregatory effect. That is one of the very important part. Very important. Questions are asking from this topic also these days. All right. So mechanism. What is the mechanism? Platelets produce thromboxane. That is TXA2 via COX-1 enzyme. All right, platelets do what? Platelets produce thromboxane TXA2 via COX-1 enzyme, and this thromboxane has the ability to promote the aggregation of platelets. Aggregation of platelets, but thromboxane is producing through COX-1. Yes, and if we give the NSAIDs, especially aspirin, it irreversibly bind to COX-1. And what will it do? It will decrease down the TXA2 synthesis, and that inhibits the platelet aggregation. Clinical use, that is low dose of aspirin. That this one is very important. Low dose of aspirin prevents thromboembolic events. That's why low dose of aspirin is generally taken in the winter kind of conditions to thin the blood, because it is also be known to as the blood thinner, isn't it? Because it will generally reduce the platelet aggregation, isn't it? So that's why it is given as a blood thinner. All right. So ductus arteriosus closure. What is arteriosus closure? In fetal life, PGE2 keeps the ductus arteriosus open, particularly the 𝑙-prostadil. 𝑙-prostadil, PGE2. 𝑙-prostadil is a prostaglandin analog which keeps the ductus arteriosus open. All right, because the fetus is itself gets the blood through mother only. That's why there is a arteriosus which keeps open during the pregnancy time. All right, and that is the PGE2, which is synthesized internally inside the body. That is also known as the 𝑙-prostadil. Not 𝑙-prostadil. 𝑙-prostadil is a synthetic PGE2 analog. PGE2 analog. PGE2, which is a natural one, synthesized inside the body, keeps the ductus open. Keep the ductal arteriosus open. But what happens? NSAIDs inhibit the PG synthesis and are responsible for premature closure in the pregnancy. Premature closure into the late pregnancy, which is enabled which makes the condition like the fetus is not being able to get the blood from the mother. All right. So this is the condition. Whenever a mother takes NSAIDs as a painkiller during her late pregnancy. All right. So that's why it is advised that do not take any kind of medicine during pregnancy without prior doctor's advice. All right. Chalo. Therapeutic use endomethacin is generally used postnatally to close patent ductus arteriosus. For example, yes, at some conditions also wherever the ductus arteriosus does not gets closed automatically. Automatically, it does not close during the labor. But at the time of the delivery, Endomethacin is being given to close the patent ductus arteriosus. All right. Apart from endomethacin, also that is ibuprofen as well as the aspirin. These three drugs, which can be learned through IIA. IIA is used postnatally to close the patent ductus arteriosus. All right. Yes. And the PGE2 analog, that is PGE2 analog, alprostadil, keeps the ductal arteriosus opens. All right, that is the two main thing that which is very important. This one is very important for you guys. They can ask you a question directly from here. Ibuprofen, endomethacin, and aspirin is usually given to close patent ductus arteriosus. Right? Parturition, labor. Prostaglandins stimulate uterine contractions. Prostaglandins stimulate uterine contractions, whereas NSAIDs inhibit the PG synthesis. And if the PG synthesis gets inhibited, what will happen? There is a delay in labor or retard uterine contraction, thus contraindicated near term pregnancy. All right. So next one is the renal effects. PG helps to maintain renal blood flow and sodium excretion. PGs, that is prostaglandin, helps to maintain the renal blood flow as well as the sodium excretion. Whereas when NSAIDs when NSAIDs induce inhibition, sodium and water retention takes place, edema can take place, as well as the possible renal impairment also take place. All right, so this might be the condition. Gastrointestinal effects. This one is very important for guys. This is the case for aspirin induced ulcer. Aspirin induced ulcer. All right. For example, gastric mucosa produces PGs, that is prostaglandins, via COX-1 and protect the stomach by decreasing acid secretion as well as increasing mucus and bicarbonates. Generally, what happens inside the body, the gastric mucosa, we do have the gastric mucosa, for example, we do have this mucosa. This mucosa synthesizes PG by COX-1 enzyme. And this PG is responsible for decreasing the acid secretion as well as increasing the mucus as well as the bicarbonate. But since NSAIDs inhibit COX-1 enzyme, there is a loss of protective PGs, increased acid will be there, as well as the mucus will be decreases down. So it will cause gastric pain, erosion, ulcers. All right. That's why aspirin is particularly cause gastric irritation as well as the peptic ulcers. All right. So next one, anaphylactic reactions. What are the anaphylactic reactions? These are the allergic kind of reactions. Allergic reactions. Allergic reaction. Some individuals are very much hypersensitive to aspirin. Leads to bronchospasm, asthma, urticaria, angioedema, or the rhinitis as well. That is a runny nose. All right. Mechanism. Since NSAIDs inhibit the COX, COX enzyme, but arachidonic acid synthesizes COX as well as the LOX enzyme. So whole arachidonic acid shifts onto the LOX pathway. LOX pathway. Here, LOX pathway generates the leukotrienes, leukotrienes, and these leukotrienes are very much responsible for what? For bronchospasm. All right. If this COX-1 gets down, the whole arachidonic pathway shifted onto the LOX pathway and will increase gradually, not gradually, it increase geometrically increased into the leukotrienes production, which is responsible for bronchospasm. And if the person has already been diagnosed as the asthmatic patient, this aspirin, the NSAIDs, could worsen that kind of condition, that is the asthmatic conditions. All right. So now let's move on to the MCQs part. The first question is, which of the following mechanism best explains the analgesic actions of NSAIDs? First one, inhibition of substance P, central inhibition of COX-2 in the spinal cord, peripheral inhibition of prostaglandin synthesis, activation of opioid receptors. Which one is right? Which one is right? Substance P? No. Central inhibition of COX-2? No. Peripheral inhibition of prostaglandin synthesis? Yes. It includes the peripheral inhibition of prostaglandin synthesis. There will be a no activation of opioid receptors because the centrally acting opioid drugs activates the opioid receptors. All right. So low dose aspirin inhibits platelet aggregation by increasing thromboxane A2, inhibiting COX-1 irreversibly in platelets, inhibiting COX-2 selectively, blocking ADP receptors. Which is it? I've just told you guys that low dose aspirin particularly inhibits the COX-1 enzyme irreversibly in the platelets. All right, into the platelets. Which of the following statement about NSAIDs and pregnancy is true? NSAIDs promote labor and parturition. NSAIDs delay and retard labor. NSAIDs are used as a uterotonic agents. No. NSAIDs increase uterine sensitive to oxytocin. What is it? It generally delays the retard and retard labor because prostaglandins are very much sensitive to uh, increase the uterine contractions. But since NSAIDs inhibit those PG synthesis, that's why NSAIDs delay and retard the labor. All right. Yes. So next one. The major cause of the gastric irritation and ulceration by NSAIDs is the major cause of gastric irritation and ulceration caused by NSAIDs is direct acid secretion by the drug, increased gastric secretion due to inhibition of PGs, suppressed of HCl production, increased mucus secretion. There is a nothing kind of thing like this way. Direct acid secretion by the drug? No. Generally, it increases the gastric acid secretion due to inhibition of PGs. All right. Just told you guys the PGs are responsible for increase the mucus secretion as well as decreasing down the HCl secretion. But when the PG synthesis gets down regulated, those thing gets converted vice versa. That means gastric acid secretion increases and mucus development decreases. All right. So, which of the following NSAIDs is a preferential COX-2 inhibitor? Preferential COX-2 inhibitor. Meloxicam, endomethacin, pyroxicam, diclofenac. What is it? That one you have to tell me in the comment section. I'm not going to tell this one answer because it is already being answered into the second, yes, second or third slide that you have to give the answer of this question. Which of the following NSAID is a preferential COX-2 inhibitor? Right? So, which of the following NSAID is irreversible COX inhibitor? Irreversible. I've just told you guys that is aspirin is an irreversible COX inhibitor drug. All right. Chalo. Which of the following belongs to the propionic acid derivative class? Ibuprofen, endomethacin, pyroxicam, diclofenac. Just told you guys that this one, and relate this drug, pro word in any drug, that is ibuprofen, ketoprofen, Flupropin. Yes. So correct one will be the ibuprofen. Which of the following NSAIDs is selective COX-2 inhibitor and has least effect on platelet function? Selective COX-2 inhibitor and has least effect on platelet function, because platelet function has a COX-1 relation. COX-1 relation, not to the COX-2 relation. That's why it is a selective COX-2 inhibitor. So selective COX-2 inhibitor, I've told you guys, the word COXIB is correlated, which should be correlated with the selective COX-2 inhibitors. All right. So endomethacin, no. Ibuprofen, no. Celecoxib, yes. Celecoxib. Aspirin, no. All right. Which of the following is a para-aminophenol derivative often grouped with NSAIDs through weakly anti-inflammatory drug? That is the paracetamol. Paracetamol, that is your paracetamol. Right? Paracetamol. Ibuprofen, no. Naproxen, no. Diclofenac, no. All right. So this is all about the topic, that is NSAIDs, in which we have learned the mechanism of action of it, classification, as well as the pharmacological actions of NSAIDs. I hope I have made you clear around this topic. Till then, keep revising it and keep grinding yourself. Thank you so much.